Mr. President.
Senator from Louisiana.
Mr. President, I had the privilege today with Senator Collins to introduce a replacement bill for Obamacare. And if you will, it's been her experience as a insurance commissioner, mine as a physician caring for the uninsured and the underinsured. And let me also give due credit to Pete Sessions, who's over on the House side, who's introducing a very similar bill to come up with something that we think works. And not just for people we represent, but for the entire country. And that is our goal. So I'd like to speak a little bit about the Patient Freedom Act of 2017. And our goal, if you will, I just tell my staff to imagine a woman who voted for Donald Trump, doesn't like Obamacare, but she's got breast cancer. And her coverage has a $6,000 deductible, but she has coverage. On the other hand, she wants to see something different. If we keep our efforts, if we just view our efforts through the prism of her care, then, Mr. President, I think we'll do right by the American people. And let me say something else. Our goal, again, is not to come up with a Republican plan. It is not to come up with an anti-Obamacare plan. Our goal is to come up with an American patient plan where whomever she is or he is, they can feel comfortable that we as a Senate are trying to do right by the American people. So let's go to first principles. First principles is we in the Republican Party think that if you like your insurance, you should be able to keep it. And I'll come to that later. President Obama got rightly criticized because he pledged that. Turns out it wasn't true. That's one of our first principles. We mean it. Secondly, we think that states should have the power, not the federal government. When you speak to Americans, they want their state capital to be the kind of principal force behind how their insurance is administered, not our nation's capital. So we return power to both the states and to patients. And lastly, I will say that we are truly reaching out to Democrats. One of the criticisms of Obamacare, it was rammed through on a partisan vote with hardly a consideration given of Republicans. Senator Collins and I are absolutely open to working with Democrats for this solution. So how do we begin? We first begin by repealing the Obamacare mandates and penalties. The American people do not like Washington telling them how to live their lives. So we take those mandates and penalties for both the individual and the employer, and we take them off. Secondly, we work to make health care truly affordable. We do this by giving states a choice to put in what we call the state alternative. I think we're going to begin calling it the better choice. And in the better choice, we would use tax credits that would go to those who are eligible, that would go into an account that would be, if the patient did nothing, she would have a health savings account which would be pre-funded. The money would go in, actually put money into the account, catastrophic coverage, and a pharmacy benefit. It's important to note that she would have the power over this account. If she wished, she could combine it with her family and these different tax credits, and they could buy a richer family policy. Or she could assign it to her employer as the employee's contribution for an employer-sponsored plan. If the family decided each of them to keep their own HSA account, and one of them got a terrible illness and they kind of went into the cash portion, they exhausted their health savings account, we would allow family members to donate their health savings account balance to each other to help cover that cash exposure. We do different things, but the goal is to give the patient the power. Now, we also, since we are going to these health savings accounts under the better choice model, that's okay, you can leave it here. In the better choice model, again, we give these tax credits that go into a health savings account. The individual can donate their own money or the employer can contribute theirs. Here are some of the options that they can do. But whichever option they have, we institute price transparency. That is to say that when the patient goes to have her blood test, she will know the cost of the blood test before she has it done, as opposed to finding out later. This came to mind this past Sunday. I had a friend in town who was in for the inauguration. She's a physician, and she went for a vitamin D level. When she goes for a vitamin D level, she gets the bill. It's $290. She calls up the hospital. She goes, I order these all the time. Am I really getting a $290 charge on each of these? Oh, yes, ma'am, that's what we bill patients. So she goes to different labs and she finds out what the cash price is for the panels of labs she typically orders. She has a patient come who's from out of town paying cash, and she says, pay me $38. It'll cover the labs. Here's the slip. Go to the lab. Patient pays $38, but goes to the wrong laboratory. She's from out of town, not quite sure where to go. She goes to the wrong laboratory. The bill she gets, which in one lab would be $38, in the other lab is $690. My physician friend calls the hospital, says, you gotta be kidding, $690. They reduced it to $380. There is a tenfold difference in the cash price for labs. If the patient wanted known that, she probably would have paid more attention to the directions. But certainly if the price of the labs were posted when she went up, even if she went to the wrong place, she could have looked at the fee schedule and decided that she needed to go someplace else. One of my young men who works with me said, yeah, I get it, price transparency. Who would buy a car without knowing the price beforehand? It would be great for the car dealer, but really lousy for you. That's how we purchase health care now. It's great for the folks selling the service. It's pretty lousy for the person selling the cash, paying with cash. And by this, we think we begin to use market forces to reduce costs. By the way, this is not only about saving the patient money, which is very important, but there's also an example. John Fleming is a physician who until recently was a member of the House of Representatives. And he tells the story of how a woman who worked with him, their office went to health savings accounts, and she came up and she said, Dr. Fleming, I don't like these health savings accounts. Previously, I had a pharmacy benefit that paid for my inhaler, and now don't have the same pharmacy benefit. And he goes, well, and you're under their plan at least, the health savings account, you can use that to pay for your inhaler. And he walks away. 6 months later, she comes up to him, and he turns around as she walks away and says, oh, by the way, if you stop smoking, you wouldn't need an inhaler. And then he walks away. 6 months later, she comes up, Dr. Fleming, you were right. He goes, I'm sorry, what was I didn't remember the conversation. He turns around, she goes, remember when you told me if I stopped smoking, I wouldn't need an inhaler? I stopped smoking and I don't need an inhaler. So what this does, it activates the patient. It gets her or him engaged in their health care. And between that, not only do we protect the patient's pocketbook, but we also do something positive for their health care. Now, under our plan, can we go back to the one we had previously? Let me also point this out. We think most states will go for the better choice. It is possible, though, a state will reject everything. We don't want Medicaid expansion dollars. We don't want any extra help for those who are lower income, and we would give states that choice. This is not Washington, D.C. forcing something on people. Let me also point out something else. Republicans believe if you like your health care, you can keep it. Your health insurance, you can keep it, and we mean it. If a state decided they wished to stay in Obamacare, I think it's a terrible decision. But this legislation would allow a state to do so. I was so disappointed. I saw that the minority leader, Mr. Schumer, criticized our bill, said things that weren't true, fake news, if you will, and that we didn't cover pre-existing conditions. We do. That the deductibles and copays would be too high. That's not true. But what's striking is that he hasn't read our legislation yet. This is what's wrong with Washington, D.C. Here we have something which in good faith would allow New York to stay in Obamacare if the people of New York decided they wish to, but we can look at double and even triple-digit premium increases in other states, and without reading our bill, other states are going to be condemned to these double and triple-digit premium increases because folks don't want to consider something different. This is not a Republican plan. It is not a Democratic plan. We want it to be an American plan where states can decide the best system for their state, and if it's working for New York, they can stay in New York. It's not working for Louisiana, and so our state would go with the better choice, I am confident. But that said, please don't criticize the plan before you even look at it. And please allow those in the Democratic side who are down to one insurance company on their exchanges with double-digit premium increases to at least consider an option that would be good for their state. Now, folks say, well, hey, you don't have a mandate. We don't think Washington, D.C. should be telling people how to live their lives. So how do we, under our better choice, get folks to get the kind of big insurance pool without a mandate? We give states the option to do what we call automatic enrollment. If someone is eligible, they would be enrolled. The tax credit they receive would be adequate for their premium. They would never have to put anything out of pocket to have this health savings account, high deductible health plan and pharmacy benefit that would be covered with the tax credit that they received. And by doing so, all these young males who haven't signed up for Obamacare because they're paying too much would actually be enrolled in an insurance plan. And now, for those who get ill or have chronic conditions, you're spreading the cost of their expensive illness over the many healthy and not just over the few sick. It restores the law of big numbers. We had an insurance plan model this, and they said they think just by doing our method of enrollment, it would lower premiums by 20%. That's without an individual mandate. By the way, think of the folks that will never sign up for an Obamacare exchange policy. The mentally ill person living beneath a bridge. He's not going to go to a public library. If he has a W-2 form, he doesn't know where it is, and sign up for a 16-page online form to sign up for Obamacare. Under our policy, he could be automatically enrolled. And so if he goes to the urgent care center with a cellulitis, he has coverage. If something terrible happens, he's hit by a car, goes to the emergency room and is admitted to the hospital, society is protected from major expenses. And if he gets his life together enough, he has a pharmacy benefit to provide him those antipsychotics. So we actually think we will increase the number who truly need health care, the number of those who are covered. Let me finish up by speaking about our timeline. We would hope over this next year that Republicans and Democrats can come together. I understand Democrats will not vote for a reconciliation bill that begins the repeal process of Obamacare, but that almost certainly will pass. What we would hope is that sometime within this year, Democrats who live in states with only one insurance company on their exchanges, in which premiums are increasing by double, maybe even at that time in their states, triple digits, would come together to vote with us to give their state an option for our better choice. So we would pass that legislation in 2017, giving their state legislatures and governors the option to choose this pathway in 2018. In 2019, the states would implement their option of choice, and by 2020, it's all been done. That is our hope. Folks say Senator Collins and I are naive, that the Senate cannot overcome its partisanship, that inevitably it'll be so partisan, people without reading bills will criticize our legislation, saying things about it which are not true. And I go back to where I started. That woman didn't go to college, working hard, voted for Trump, doesn't like Obamacare, but has breast cancer. She needs coverage, and she wants something done for her. We want to give her the power. We want to give her that coverage. And my goal is that when this finishes, as she goes from cancer to health, the only thing that she knows about her coverage is that decisions about her health care are made in her state capital and around her kitchen table, and that as her breast cancer is treated, her health coverage improves. That's our goal. It is not a Democratic plan or Republican plan. It is not a partisan plan. It is a plan for her. That is our goal. And now I yield.